Hello, welcome everyone. We are still getting settled, but I wanted to welcome you to our webinar this evening entitled Being Kind, How Much Sociability Matters. My name is Meg Holden and I am the host and moderator for the evening. I'm the director of the Urban Studies program at SFU and very grateful tonight in Vancouver and the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh First Nations, and others of the panelists here beaming in from across Turtle Island and all the way across the Atlantic in the United Kingdom, and also acknowledging how late it is in the United Kingdom, and special thanks to those who are joining us from far away. I mentioned that I'm here from the Urban Studies program at SFU. We are also co-hosting this webinar series with our friends at SFU Public Square, and you'll see colleagues from SFU Public Square helping you with any technical questions or matters that you might have throughout our time together this evening. So please don't hesitate to use the chat box to ask for technical help, and someone will come to your rescue as best we are able. The intention behind this series of webinar episodes, events, conversations is to take the time to reflect and think deeply about the profound disruption of the COVID-19 pandemic and our response to it, to our lives in cities. And so this is one of a series of events that we are hosting in order to bring a focus to different aspects of the changes that the COVID-19 pandemic is having and is sure to have on our cities. This event is also part of the SFU Initiative in Urban Sustainable Development, which is funded by the Real Estate Foundation of BC and the Fraser Valley Real Estate Foundation Association. And so we're very grateful for that. You guys have noticed that this session is being recorded. That's so that we can post it online and allow more people to build from, build upon, pull apart our conversation and take it forward into the future. We've got quite a large group of attendees, and that's fantastic. All of you are important participants in our conversation tonight, and I want to encourage everyone to ask questions, make comments, send us your thoughts along the way. And you can do so in a couple of ways. One of them is through the Q&A window that you'll find within your Zoom controls. And you can type in a question or a comment at any time that way to the panel. You can direct it to a particular panelist if that's appropriate, and that would be appreciated, because after our panelists have a chance to provide their initial remarks, we will have a Q&A session. Also, there's the possibility, if there's time, and if we're able to gauge our screens and navigate them, to answer some of your questions in written format. So you can keep an eye on that chat, on that Q&A window as well. We'll do our best to field as many questions as we can. And also during the Q&A session, we would like to give you the opportunity to voice your own question. So Aphrodite, who's here helping out in the background, will be calling your name and asking you to unmute yourself when called upon, and in order to voice your own question. We'll do that as best we can. The chat window is another window that you can use for, as I mentioned, any kind of technical support that you might need, or the kinds of conversations that you might have in whispering tones with people close to you if we were having this event face to face. So please make use of that. We're also offering closed captioning of this event for anybody for whom that makes the following and participating a little bit easier. So please, you have to activate that yourself on your screen, but you'll be able to find that in your Zoom controls. So tonight's discussion is about kindness. Be kind, be calm, be safe. Those are the three directives that we've been handed time and time again by one of our fearless health leaders in British Columbia through the pandemic, Dr. Bonnie Henry's mantra that's been guiding our response to COVID-19. And two of those are fairly intuitive to me as policy prescriptions, and one of them is not. And it's the one that is not that is going to be the focus of our conversations this evening. We're going to put this call to kindness front and center of our discussion of coping with and recovering from the COVID-19 pandemic. Some initial survey research that I've seen has shown that up to 50% of people surveyed in the United Kingdom are experiencing depressive symptoms as a result of the pandemic. Those who were not experiencing any such symptoms previously. And I think it's safe to say it's no accident either that we have another gruesomely record-setting year for overdose deaths in Vancouver here. And that's just the tip of the iceberg of what we're seeing in terms of signals of breakdown of sociability, kindness, civility, and some of the real roots and fundaments of social trust in civil society and in our societies and cities. The changes to social life resulting from the COVID-19 pandemic are perhaps the largest psychological experiment in human history, and they're felt most acutely in our cities. Some of these trends that we're seeing today are just amplifying trends that we already saw pre-pandemic. So solo households, people living alone, are now the most common household type in Canada, and they had been in 2016, up to 40% of households in the city of Vancouver. Renters also are the majority of tenure types within the city of Vancouver and edging that way throughout the region as a whole, as they tend to do in urbanized regions. And we have the perception of renting as being a kind of housing tenure that leads to a decrease in sociability or certain barriers to socializing and to civic trust and friendship and neighborly formation. But the city, all through this time, had still had a linchpin argument in its favor, and that argument was density. The city has had the argument in its favor of centrality, proximity, and of course, we've seen more and more people voicing their complaints about density and what kinds of risks and dangers that it brings to them. But now with the pandemic and our response to it, those complaints and those fears and those concerns have reached a whole new kind of amplitude of volume. So now proximity has become a bad word and in fact the key source of risk of infection and disease. Where do we go for cities from this point? There are lots of reasons why cities make sense in terms of our human need for sociability, for human connection. And in fact, we've kind of gotten off easy as urbanists in not having to talk about them much because the built form arguments for density have been more obvious. But now we have to make a case for things like tolerance, empathy, even division of labor, recognition of the gross inequities and injustices when they're staring us in the face in our homes and communities, and the platform that cities provide from which to speak out against what we see as injustices around us. So the pandemic in a way forces us to think in a more radical way about what it means to live side by side with our neighbors who are very different from us, from race to class to life stage, life plan, sex, gender, physical ability, and the question of how we see this as valuable. And that is really the terrain that we'd like to travel with you today. So I am going to introduce our panelists in the order in which they're going to present. And so first of all, I am going to introduce Helen Pinio, an assistant professor with the Institute for Environmental Design and Engineering from University College London. And her first remarks to talk about how we are living through not just a pandemic, but a syndemic. Helen.
Hi, so I'm assuming you can hear me now. I think I might have been unmuted. Can you nod, Meg, if you can hear me okay?
I think, yes, we can hear you fine. Can you just turn up your volume a little bit?
Um, how's that?
Perfect.
Okay, great. So I'll share my screen. So thank you very much for having me at this virtual webinar. I think it's a great way to practice speaking internationally without getting on an airplane. I think this is definitely the way forward. So I'm going to talk about kindness, COVID, and urbanism. And I will start by defining what we mean by a syndemic, because this has been described as COVID-19 not being a pandemic, but actually being a syndemic. So we have here a couple of definitions from a dictionary of epidemiology, where an epidemic is the occurrence in a community or region of cases of an illness or a health-related behavior or other health-related events that is more than we would normally expect. And so epidemics can be infectious diseases, but they can also be something like obesity or the opioid addiction crisis. A pandemic is an epidemic over a much wider area, more people are affected. And then we come to syndemic, which is what people have said COVID-19 is actually a syndemic. And this is a relatively new concept. And it's where we have the clustering of two or more health conditions within a particular context. In this case, it's global. We have the interaction of those conditions via biological, social, or psychological pathways, and involvement of social, political, economic, or ecological drivers. And I think with COVID-19, we've had all of those interactions, all of those drivers, and certainly the clustering of multiple health conditions where we've seen people are at higher risk when they have background conditions like diabetes or heart disease. With the environmental and ecological drivers, we've seen that people who are living in areas with high air pollution, poor housing quality, and household overcrowding have all experienced higher death rates. So there's been an association across those factors. And we are still trying to understand the cause and effect relationship. But it does demonstrate what Meg said, that we realize with COVID-19, it's exacerbating existing circumstances from our environment and social circumstances and how that affects our health. So we've known for many decades and even centuries that there are structural barriers to health, and that the highest environmental burdens in our cities and even in our rural areas are in low income and ethnic minority neighborhoods. And this has certainly been the case for COVID, where people have been locked down in neighborhoods where they haven't had access to green space or access to healthy foods. And that's really made their health worse off, but it's also on top of the pre-existing circumstances that they already had. And on top of low income and minority ethnic groups being increasingly exposed to unhealthy environments, we also know that there are barriers to our health through the design of the built environment that affects other groups like women, children, the elderly and disabled, and others. And I would particularly point out in the context of kindness, hostile architecture like the image in the center, where that paving is particularly used to stop people from sleeping in that space. And so we can imagine how in the case of COVID-19, the built environment and other spaces have certainly seemed much kinder or less kind to some groups in society. So how does kindness play out in a syndemic? Well, I think we saw huge displays in the UK of kindness toward each other, and we were encouraged by the government to be kind to each other through wearing masks and only shopping for what we needed and only going out when we needed. And we were better at some of those things than others. But we did see that kindness wasn't displayed or distributed evenly across society. And so, one thing I would really highlight would be playgrounds and schools in the UK were closed for months after pubs and restaurants and workplaces reopened for adults. So, I think kindness wasn't distributed evenly, and that will have had health impacts. Like Meg said, uh, depression and other mental health issues have gone up, but also really concerningly, they've gone up amongst children. So I would also say we need to extend kindness beyond people, and the pandemic has really underscored that perhaps through our past actions in relation to natural resource extraction and rapid urbanization, we have increased the likelihood of a zoonotic disease coming into the human population. We did see transport emissions going down, and that was a positive thing during the lockdown. Oh, many people saw how important nature was to them in their day-to-day life for their health and well-being. But we've also seen single-use plastics go up, and that's very worrying for the long-term trend in that area. So I think kindness to the environment needs to be increasingly part of our view about how we have health and well-being going forward in our cities and in our world. And I would like to put forward this new conceptual framework for healthy urbanism. It's called Thrives, and this stands for Towards Healthy Urbanism, Inclusive, Equitable, Sustainable. And I think there'll be a link available to you in the chat where you can see more information about this framework. It's based on theory in epidemiology and urban planning and sustainable development. And it's trying to highlight the fact that actions that we take in building design or urban policy will influence health in cities, but also globally, and that will come back and influence health in cities. So it's really broadening our scale of thinking about how actions we take within cities can support global health, but also urban health. And in applying the principles from the Thrives framework, I would say that we can insert practices of kindness into urban policy moving forward from the pandemic. And that can be done through three key mechanisms. So first, I would say we need to recognize that the health impacts of new development or regeneration projects often occur far away from those changes to the urban environment. So we need to think beyond the boundaries of development. And that's not only spatial boundaries, but also temporal. So broadening out our thinking of how our actions in the urban environment will impact health. That could be through the selection of materials that we use for construction, but also thinking of how neighboring communities will be affected by the public space that could be made available or improvements to public space through new development. The second mechanism is that structural barriers prevent healthy living for many people. We need to stop using the language of healthy lifestyles and individual behavioral choice in relation to health and talk more about structural barriers, particularly when it comes to urban policy and the built environment. And so to address that, we should target interventions in areas where they are most needed. And we should design and plan with inclusive processes. We shouldn't assume that we know what kind of infrastructure and what kind of design will be good for everybody in society. We should do that in an inclusive way. And finally, we need to recognize that environmental degradation affects health now. It's not something happening in the future, it's happening now. And so we can use very well understood sustainable design principles to support health, and not only health, but also well-being and social cohesion. So I would say in closing that I think healthy urban policy looks like some of these places resulting from healthy urban policy, and they are co-produced and sustainable, they are affordable, and all of the other words I've written here, but crucially, I would say maintained and supported over time. So healthy urban policy isn't just about the policy mechanism, but how we support those communities once places have been built. And you can find more information on these websites, and I think they have been posted into the chat. Thank you very much.
Thanks very much, Helen. That's a great opening synthesis to kick us off. Can I just ask you to go back one slide and tell me what that brightly colored piece of building is?
Yeah, so that is, I think it's a community center in the Mariposa project in Denver, Colorado. And I haven't actually been there. Most of those pictures are mine, but that's one I haven't been to. And it was a large mixed use regeneration project with a mixture of tenures as well, but it's been evaluated and described as healthy. They did have a lot of really strong community design in the project. And so I think that's one of the reasons why it's featured.
Thanks very much. Yes, I recognized a few of those developments. I recognize the Bullitt Center down in Seattle, one of them.
Yep.
Thank you very much. Next up, we have Michelle Hoare, who, among many other amazing feats, is the director of the Hey Neighbor Collective. And so we've heard now an overview of what it would take to design the physical spaces of cities in a healthful and equitable and sustainable way. And Michelle is here to tell us a little bit more about how to approach these ideas from more of a social policy perspective. Michelle.
Okay, thank you very much. Can you hear me okay, Meg? Yeah, all right. So when I was asked to speak about kindness and its relationship to the pandemic and public policy, I have to admit I felt a bit overwhelmed at first. Often when I feel lost in the enormity of a word or an idea, I turn to the dictionary and look back at its etymological roots. It's a bit of a nerdiness that I tend towards. So the word kindness is at least partially derived from the terms kin and kind. Oh, sorry here. There we go. So this means that we treat people with kindness, respect, empathy, compassion, and care when we recognize that we have something in common or when we consider them to be like family. So as a public health message to get us through a pandemic and to be encouraging individual actions that lead to collective care and safety, it's very hard to find fault with be kind, be calm, be safe. It's very reminiscent of UK wartime messaging like this one: your courage, your cheerfulness, your resolution will bring us victory. But when I really thought about what this phrase means to me and how it connects to policy, it made me question, do we really live in a kind world? And I think both Meg and Helen got to this already, but a kind world isn't one where we are suffering so many chronic stressors, increasing economic inequality, homelessness and affordable housing crisis, opioid poisoning, racism and other forms of discrimination on the rise, and loneliness and social isolation. And are we really safe? Not really. We're experiencing a public health crisis now. There will be other ones in the future. We have climate change impacts that we're experiencing now that we know will worsen and that will be more impactful for people who are already vulnerable. And of course, there's always natural disasters like earthquakes that we have to be prepared for. So can we really be calm in the face of all of this? I don't feel calm. But I'm not here to talk about Dr. Henry's messaging. I'm here to talk about the project that I work on, which is called the Hey Neighbor Collective. The Hey Neighbor Collective is a project housed at the SFU Morris J. Wask Center for Dialogue, and it brings together housing providers, researchers, nonprofits, local and regional governments, housing associations, and health authorities. Our practice partners are experimenting with different ways to build community and resilience in multi-unit housing. And then we are looking at kind of systems change approaches to that work. So really what we're looking at is the chronic stressor of loneliness and isolation within the context of multi-unit housing. And the overarching goal of all of this is to increase social connectedness and resilience amongst neighbors. And for that increased individual and community resilience to protect residents of multi-unit housing against chronic stressors and acute shocks. Because really, at the end of the day, it's about who you have in your toolkit. That's even more important than what you have in your toolkit when it comes to a crisis or an emergency. So why is social connectedness with your neighbors in particular important? Well, any kind of social connection is great for protecting against personal health risks. And I suspect that Kate Mulligan will go into that more. Knowing your neighbors even a little bit, even by sight or their dog's name or their kid's name, makes you more likely to give and accept help in a crisis where you may not physically have access to other networks of support and mutual aid, like your friends, your family, people in your cultural or religious community, that kind of thing. Also, having diverse and strong neighborhood social connections contributes to a deeper sense of belonging in your neighborhood and in your community. And when you feel that sense of belonging, you are more likely to participate, to engage, to volunteer, to vote, and to take other action that strengthens civil society. So we are individually more resilient if we have social connections, and we're more resilient as a community. So why do we focus on multi-unit rental housing? These are all some statistics that were derived from a Vancouver Foundation survey done in 2015 and then redone again, I believe, in 2017. But they found some pretty strong differences between people who lived in high-rise apartments and single detached homes in terms of, percentage of people who knew their neighbor's name, feeling alone, having difficulty making friends, trusting your neighbors, or doing favors. It was demonstrably lower for those that were living in the particular form of kind of multi-unit housing, apartments, high rises. And that was across kind of people who rented and people who were in owner-occupied condos and whatnot. So Meg went into this a bit in her introduction, so I won't go into it much, but we focus on renters because there's further research to say that you're even less likely to have those strong community connections if you're a renter. And that could be for any number of reasons, being continually priced out, being rent evicted, being dem evicted, you name it. Or being, renters generally are also lower income, and that also predisposes you towards, any number of things. But social isolation and loneliness is one of those. So the way the Hey Neighbor Collective works is that the core of our project is a community of practice that's made up at the moment of 3 rental housing operators and 2 nonprofits. And all of these groups are doing some form of intentional community building in multi-unit housing contexts. So they represent together work that is either being done right now or being planned for about 40 buildings in Vancouver, Victoria, Penticton, and soon to come New Westminster. So we have a community of practice for those folks. So they can share what they're learning, they can talk about what's working and what's not, and they can encourage each other in that practice. And then we connect them with researchers at SFU and at Happy City to look at the impact of that work on resident well-being and other factors. And then we have a whole number of partners who are who join us to kind of learn about what we're learning about and to look at over time what that means for their own organizations, their own policies, their own practices. So these are municipalities, regional governments, health authorities, groups like BC Nonprofit Housing and Landlord BC. So I'm going to flip from here to try to walk you through my neighborhood a little bit and a few activities that some of our partners are doing in order to illustrate some reflections on the potential for residents, landlords, and policymakers to work together to make multi-unit housing, rental housing more socially connected and resilient. So these are 2 buildings in my neighborhood of Mount Pleasant. I have lived as a renter with my husband and 2 kids in this neighborhood for 18 years. And there are tons of this type of building around, 3 or 4 floor walk-ups, 60s to 80s, many of them without balconies. and most of them with nothing going on in the yards, no gardens, no benches, no anything. And you very rarely see people socializing outside. But the park that's nearby is incredibly busy and very heavily relied on. Oops. So this is a building that I lived directly across from for 16 years. And while I was there, I moved a year before the pandemic. I never met anybody that lived in that building. I'd maybe say hi to them on the street, but it was very, very casual. But when COVID hit, a group of residents got together because I guess they felt pretty cooped up. And they approached their landlord, and he gave them permission to start digging up gardens and building beds. And with a $500 grant, the neighborhood grant, they built this amazing space. And now there's tables and chairs, and you go by and they're playing music and eating lunch and talking about their gardens and talking to other neighbors. And it's really been quite a transformation. And I talked to this woman, Sarah, who's one of the residents. And she said that since doing this, neighbors have gotten to know each other so much better. They have a WhatsApp group. They help each other with pets, with groceries, with lost keys. And they've even helped to convince a landlord of another nearby building to do the same thing with his tenants. So if something like this is possible with $500, some sweat equity, and just the thumbs up from a landlord, what would be possible if landlords actually really committed to building community with their residents? Okay, my slides are not going right here. 1 second. All right. So this is a building called Madrona. It's owned by Catalyst, who's one of our partners. They're a nonprofit developer, owner, and operator of below market rental housing. And they decided to commit to a program that they call Community Connections. And it's quite a simple program, really. They do social events with their tenants. They do what they call town halls, which is really just conversations physically before the pandemic, now digitally, where they talk about issues with the building. They talk about building policies, and they will work together to kind of co-create the next event or the next tenant-led initiative. And there's been all sorts of interesting things that they've done together in really quite a short time, just a little over 2 years. And this little bullet I have here about COVID safety, this is just a little anecdote. Moira Chestnut, who leads this work for Catalyst, when the pandemic hit, she really, really quickly moved to communicate to all the tenants of all 4 of their buildings at that time that they did not need to worry about rent. Nobody was going to get evicted. And they worked really, really, really hard well before the provincial government said anything about eviction moratoriums to make sure that their tenants felt safe and secure and well supported. So they're also, as they do all of these kind of activities, they're working with SFU to do tenant surveys and to document how these different kinds of interventions and experiences are going. So that's the kind of thing that can happen if a landlord really commits to working with residents, and we're only seeing the beginnings of this. But what happens if you go a little bit further and connect with other community partners? So Connect and Prepare is a project that is also one of our partners. And they're actually a partnership of 2 other organizations, Building Resilient Neighborhoods, which is a nonprofit based in Victoria, and Victoria Ready, which is the City of Victoria's emergency preparedness team. So they work together to deliver a program called Connect and Prepare. It is a series of workshops that take place over, I think, 4 to 6 months usually with residents. And they plan for emergencies together. And not just the big earthquake, but everything else, extreme heat, you name it, and now public health emergencies. So they work with residents to come together, and really the philosophy is that if you build those social connections, that's what really gets you through that idea of who's in your toolkit versus what's in your toolkit. So These are some pictures here of kind of a socially distanced workshop that they did in the summer to keep going with their work. And they partnered with another organization, another small nonprofit called Neighbor Lab, and they are working on this piece over here, which is basically a kind of an emergency social gathering bench. So it'll have solar powered chargers for phones. It's got an information board about tsunami risk and other things. There's a bench here at the back of this that people can sit on together, and it's got emergency supplies within it. So this is the kind of thing that you can do if you're not only working with your residents at this building scale, but if you're kind of fanning out to bring in other types of partners. So what I want to close with is some thoughts about what policymakers and funders and their like can do to support this kind of work and these kind of opportunities. So if you kind of go back to that first slide where it was buildings with nothing happening, let's assume those buildings that people don't know each other very well in there and that their landlords are not very involved, or maybe that they even frustrate attempts by residents to get together and organize and connect. In particular for residents of buildings like that, we really need our policy makers to continue to strengthen protections for renters while balancing the financial realities of both nonprofit and for-profit rental housing operators, so that people feel safe and secure in their homes so that they can actually kind of commit and engage in their community. But we also need diverse housing options for staying in our community of choice. So that means that we need to prioritize the protection and renewal of existing affordable housing and rental housing, but be rapidly building more, because there are all sorts of good reasons for renovations or even demolitions of existing affordable housing. But if you have nowhere else to go, or you're not protected by strong laws that ensure that you can make that transition, then it really all falls apart. So we have to really knit that all together. And we have to think about spatial equity and access to social infrastructure. Helen talked about this a little bit, but we really need to ensure that all residents, regardless of housing tenure, income, or other socioeconomic factors, have access to nearby, accessible, safe public spaces, both indoor and outdoor, for recreation and social gatherings. So my focus here on things like, gardening and outdoor gardens, that's just one of many things we can be doing. But it's a particularly potent one for bringing people together and also growing food and expanding food security, which is important. And finally, in this space, we really need to be thinking about sociable design when we are building new multi-unit housing, but we need to make sure that when we do that, we're not sacrificing affordability, so that we don't just end up with beautiful condos that have all the great amenities for gathering and socializing and building that community and that connectedness, but it's only for people who are well off. That's not what we need. And then we can also be expanding funding for resident-led community building projects, like the one that my neighbor was doing in her in the yard. And we need to encourage and incentivize landlords to work with residents on more substantial social retrofits of buildings and outdoor areas. And we can be looking at those that have environmental or sustainable co-benefits. So if you're getting money through different programs to do stuff around energy efficiency, think about what you might be able to do in tandem that would support social connections.
Michelle,
and then,
can we wrap up, do you think?
Yes. Sorry, I didn't, for some reason, I'm not seeing the timekeeping, so I apologize. I will wrap it up there. Just to say that we need to build awareness of these opportunities and create robust and stable funding streams for intentional social programming.
Thanks very much, Michelle. That's fantastic. Yeah, that's a great overview. And I think we can probably return to some of those policy directions and what else is going on with the Hey Neighbor Collective in the Q&A. Thanks.
Great. And apologies for going over. I for some reason didn't see Seth in the timekeeping.
That's okay. Next up, we have Kate Mulligan, and Kate is going to bring an important non-Vancouver Canadian perspective to our conversation. Kate is the Director of Policy and Communications with the Alliance for Healthy Communities, and also affiliated with the Dalla Lana School of Public Health at the University of Toronto. Kate.
Thank you, Meg, and thanks so much, everyone, for having me here. I'm coming at you from the traditional territories of the Anishinaabe and Haudenosaunee, under the current guardianship of the Mississaugas of the New Credit, and of course, home to many Indigenous peoples from across Turtle Island and the world. And I'm really, really thrilled to have been invited to speak with you today about community health as a form of individual, but also structural kindness focused on what matters to you. So, I think Helen and Michelle and Meg have already spoken to a lot of this, but health is relational. It's not something that's located just inside our own bodies or inside our own brains, but happens in relationship with ourselves, with our communities, with our environments, our cultures and economies, and of course, with power relations. And the work of health promotion is really just the process of empowering people and communities to take more control over the conditions for our own health and well-being, for our own relationships. And I wanted to start by showing you this picture of COVID-19 percent positivity for Toronto neighborhoods. So in the city where I live, and the darker the color of the neighborhood, the higher the percent positivity for COVID. And you can see that here in Toronto, concentrations of COVID are in the outer suburbs. So if you look at that northwest corner, for example, you might have seen this in the news if you are following any Canadian news about COVID. It's this map, it looks just like almost every other health geography of the city of Toronto. So Northwest Toronto is a place of multiple deprivations, from poverty and insecure work to high concentrations of immigrant Black communities, for example, and many essential workers in this time of COVID. But it's also a place of significant capacity at the community level. And that's part of the story that I want to share with you. So Helen already spoke about COVID as a syndemic. And I think one of the key things that we have learned working from local level community health centers, Aboriginal health access centers, and other equity focused comprehensive primary healthcare organizations is that colonial and hierarchical approaches that we may have inherited from early Canadian days and industrial era public health approaches that sort of think that one size fits all with respect to communication or testing or approaches, they're just not enough. And sometimes they're often they're counter to real action on something that's as complex as a public health syndemic. So what we really need is to unlock the power that's in community through complex adaptive solutions, which are actually much simpler than that sounds. They're community approaches rooted in relationships, in trust, in kindness, and in lived expertise. And that's what's going to make a difference and what is making a difference with respect to COVID in the city I live in. So as I mentioned, I work with the community health centers and other organizations that follow this model of health and well-being. And Seth is sharing a few links with you throughout this time, including some academic literature and also some public-facing literature about this model. But all the community health centers and colleagues within our Alliance for Healthier Communities follow this model of health and well-being rooted in health equity and social justice, community vitality and belonging, and being people and community centered. And we do that, and I won't get into all the different attributes of the model, but being anti-oppressive and culturally safe, looking at the determinants of health, working through a community development model, and being governed by and for the community are key elements. So in the time of COVID, kindness, for example, looks like bringing testing to the people. So we have very low testing availability in Northwest Toronto, even though the rates of COVID are high. And so community health centers have stepped up to bring testing to the people, bootstrapping grassroots approaches despite major structural barriers to doing so, and bringing kindness in, making it a welcoming and trusted environment for people So having a DJ on site, for example, or having the mobile healing bus for Indigenous populations that include not just the clinical care, but cultural care, culture as medicine for people who need it most. We know that there are many individuals and communities within our city, for example, that don't trust public health approaches, that have significant lived experience and reasons to fear racism and bias in healthcare, for example. And so by bringing healthcare to people, meeting them where they're at, we are showing a local but structural kindness. So the other piece of that that we have been working on through the Alliance is what we call social prescribing, which really is about meeting people's social determinants of health through healthcare. So for people who are significantly socially isolated, for example, or who have can live in conditions of mistrust or exclusion, their visit with their family doctor or nurse practitioner or other clinician might be their only point of contact with systems of government, for example, or systems of health and social care. And so social prescribing gives us an opportunity to use that visit or really any point of contact to reconnect people with the supports and services they need to support the social determinants of their health. So it focuses on inclusion, it focuses on co-creation, it focuses on creating a sense of belonging. And it's a very tiny, but very transformative shift for clinicians to shift their thinking from what's the matter with you to what matters to you. And this involves both a structural and an individual level kindness. That anti-oppression and cultural safety are significant ways of showing kindness, building trust, and creating spaces of more safety for people. And so the way social prescribing works is that an individual who has social and medical needs, but also interests and also gifts, is connected through a prescriber to a navigator or a well-being coordinator whose role it is to really listen and to work together to know the assets available in the community and to connect the person with what they're interested in, what they have to offer, and what they might need. And through that, they're offered a social prescription, social and community supports. It could be something as simple as a knitting group or a dance class. It could be something more significant with respect to food security or housing, or it could be some combination. And also, I think very importantly, an invitation to engage, to co-create, and to give back. And our research has shown that it's in that act of giving back that people report the greatest improvements in their health and well-being. Being reminded that you have something to give is critical, and actually giving is also critical. And so these are things that you may have experienced yourself during the pandemic, that in acts of care, in mutual aid and caregiving within your own communities, your own well-being improves. And then finally, we have data tracking. So we have a shared electronic medical record so we can track really for the first time what the health impacts are of some of these social components. So community health centers have been doing much of this work for a really long time, but not linking it back to people's clinical records or clinical care to see what the impact is on their health or what the impacts are on their use of health system resources. And our expectation and our finding to date is that people will go to more appropriate and less costly services if they're given that option and they're supported to follow through. So kindness in a time of COVID looks a bit like this. A shift from some of those in-person services to moving online. We have family fitness in French in rural Temiskaming. We have balcony workouts for seniors. We have a COVID-19 community helpline focused on by and for Black communities in Toronto in this time of Black Lives Matter as a significant place for mental health support in addition to physical health support and other community supports. We have drop-offs of food, medication, and other essentials of daily living, in addition to simple care packages and notes saying, we are thinking about you. We have telephone outreach. We have support for marginalized LGBTQ seniors to get online and find a safe space to be, particularly for those who've become recloseted in a time of social isolation. So these are the ways that we've tried to adapt and pivot the work in the time of COVID. And one thing I wanted to mention too that COVID has illustrated is the significance of kindness and the significance of what happens when we don't have it. And one thing that continues to come up in our work on social prescribing, even amongst progressives who are very interested in the more material social determinants of health, that somehow art classes or culture or walking are unserious compared to other determinants of health. But our research has shown that that's not the case, that in addition to the serious significance of those material determinants of health, social isolation, belonging, and connectedness are critical determinants of health. And we see this in sort of the feminization of care work and the structural devaluation of care work, and how that has played out in a time of COVID for isolated seniors in long-term care homes, and for personal support workers like the three shown here, who not coincidentally are racialized women, who all have died of COVID here in Ontario. We've also seen anti-Indigenous and anti-Black racism in healthcare and in neighborhoods, as I've shown, that they show that there are some very severe and significant consequences of a system that doesn't put trust and kindness at the forefront. So I just wanted to close by sharing a couple of reports if you're interested in finding out more. This Converge 3 guidance report about social determinants of health just came out yesterday, and advocates for social prescribing as a systems solution to really take action immediately on the social determinants of health in healthcare and on health equity. And then the other one, which should also be in the chat box, is our own report about social prescribing in community health centers, where we showed dramatic improvements in mental health, decreases in loneliness, and increases in social activities. And that's all for my presentation for today. Miigwech, everyone. Merci and thank you.
Thank you so much, Kate. That was a presentation full of really profound thinking and really practical alternatives that I can see you're putting a lot of heart and soul into applying. Thank you very much. We're now going to shift from hearing about some of these practical space-based design ideas for addressing kindness and bringing kindness back into cities during COVID-19, and some of the policy and structural policy approaches to the digital world, where kindness is also at issue and also under threat as a result of racism and trends before the pandemic and exacerbated by the conditions imposed by the pandemic. So for this, we are going to learn about a new initiative called Ethos Lab based in Surrey, with its founders and employees, Anthonia Ogundele and Joanne Wandalo.
Thank you.
Thanks for the introduction, Meg, and thank you all for having us. We are really excited to be here and part of this conversation. Kate has set the context for the need and importance of anti-oppressive and community-centered lens. I believe the examination of the status quo is an integral piece in answering the question, what does it mean to be kind within the context of ethos? But first, I should probably answer, what is ethos? So Ethos Lab is an innovation academy for youth ages 13 to 18 to incite curiosity, build community, and promote personal growth and development in a rapidly changing world. We provide access to emerging technology, culture, and an impassioned community of innovators. Ethos Lab's participants gain real-world problem-solving, engineering, and science skills while exploring the fullest expressions of their authentic selves, making for smarter, happier kids who are better equipped to navigate the environment around them. I'll start this by outlining the social environment in which Ethos Lab emerged and the work we do, and then I'll demonstrate how kindness shows up for us. So Ethos Lab was an emergency response to a critical lack of representation in STEM and specifically tech for Black youth. We were in operation prior to COVID-19, but our timeline was accelerated at bringing us into the digital sphere sooner than anticipated. While our work is primarily around STEM education, we're not a STEM-focused organization. Ethos Lab is a people-focused organization, and we use STEM as a way to engage with ourselves and the world around us. In doing our work, we encourage kindness through creating safe virtual and physical spaces, as well as opportunities for youth that specifically center the humanity of the Black experience in its diversity and its uniqueness. We see kindness as an act of co-creation. Our ethos as a community is to foster a natural ecosystem and rhythm so that it reflects, respects, and protects who we are as people. Ethos Lab is designed to attract Black youth between the ages of 13 to 18 as primary users to establish a culture where they feel accepted, reflected, and protected. But Ethos Lab is accessible to all youth between those ages as well. We believe the empathetic and active participation of non-Black youth members is essential in creating spaces that are kind and that also benefit everyone. The design approach that we use specifically focuses on co-creation. Co-creation is at the heart of all the work that we do, with youth as the drivers and us as enablers in creating space that addresses the diverse needs of the community. Atlanthos is our virtual space. It's a collaborative social virtual reality space, and it was co-created by youth with support from members of the community. It was also a result of a hackathon where we asked youth to describe what the digital community could like, and then we tested it out. In the work that we do, we know that Black youth are underrepresented in demographics, specifically in tech. So we build a space. When we were building the space, we were confronted with the challenges of a lack of Black and brown avatars in the world. So we've all seen what happens when STEM education doesn't value our humanity, wellness, safety, and the full participation of everyone involved right from the start. We need only to look as far as gaming to see that racism is spewed in digital environments. When we look at digital and virtual environments, they're often socially unsafe spaces for Black youth. It's difficult to feel welcomed in spaces where you don't feel safe, let alone seen. So from bullying to overt and covert racism, engaging in digital spaces outside of your social circle can be a particularly daunting experience for Black youth, and we aim to create a space that allows opposite interactions. We believe that when you create spaces for the most underrepresented, they benefit and greatly impact communities as a whole. For many, COVID has created a heightened reliance on the digital realm, especially for sociability and connection. We believe it's our digital responsibility to create more opportunities for safe community spaces. We think that this highlights our radical notion of kindness. The future is an exciting space with fantastic new technologies, limitless possibilities, and solutions to modern day problems, and they are abound when we envision what the future could be. At Ethos Lab, we believe that the ideal future for everyone means co-creating with everyone. To us, inclusivity and co-creation are valued, and they are essential in what we see as a radical notion of kindness. We also see kindness as an act of community. So in the ways that we engage, we take a holistic approach to support kindness through engaging the community and not just the individual. Striving to go beyond our delivery mode, we introduce young people to opportunities of learning, especially within the larger community. This is seen in the ways that we connect youth with opportunities that go beyond our scope. We partner with value-aligned organizations to create these opportunities tailored specifically to areas of curiosity amongst our youth. Examples of the past in this have been meaningful engagement and mentorship opportunities, access to conferences and other spaces youth aren't traditionally seen or invited into. And in doing that, we create opportunities for youth to see themselves in roles that are traditionally adult roles. The engagement that we do goes beyond the individual and extends to the community surrounding. A lot of the parents have shared that they can see an impact in our work outside of the learning environment. We draw on areas of curiosity in individuals to create programming that authentically reflects the youth's interest. And in the engagement work that we do following up these events, parents have seen improved confidence and an increased sense of self, as well as a curiosity and new sparked interest in fields that youth frankly didn't see themselves in prior to. We also see kindness as an act of individual empowerment. And we realize that we can't predict the future, but what we can do is build strong, confident people who are able to make the future a better place for everyone. We try to empower youth by exposing them to new and emerging technologies, as well as enabling them with skills and tools to create futures they want and the futures that they want to see. We center the individual to empower kindness. Our programming and workshop continues to reflect the curiosity of youth who participate in them, as well as youth who are friends with those who participate in them. And we continue to seek out opportunities outside of our work to continue to help youth flourish. We try to build self-compassion and kindness into physical and digital spaces and opportunities to express their own identities. A lot of the workshops we do something called a gratitude checkout, where youth are given space to just say something that's going on in their life that they're grateful for or excited for. And especially in the times that we're living in now, I think it's a really good opportunity for youth to remember things that are less heavy, are light, and bring them joy. So creating a community where individual identities are valued creates an opportunity where kindness can flourish. In centering the individual, we see kindness and uniqueness in each person, and we just want to create a space that lets that flourish. And lastly, we see kindness as an act of integrity. It's so important at Ethos and in all the spaces that you show up to feel that you can bring your whole self, your whole identity, and all of your practices and quirks into your current times as well as the future and the future you want to create. We continue to center the humanity of the Black experience and individuality, and we acknowledge that it's okay to bring every aspect of who you are to Ethos Lab. We encourage integrity and honesty and being in integrity with yourself, meaning you're allowed to show up to our workshops and share that you're not doing okay or that you're having a hard day. And we continue to try and create space that allows that honesty and integrity with yourself to flourish. We think that seeing yourself as who you are and being in a space that accepts you for who you are allows authenticity, and I think it adds to our community. I'll close this by saying that kindness is something that's required at all levels, from individuals who are youth, parents, other organizations, to the community. I think that all of us occupy any one of those spaces at any given time, and sometimes intersecting within those spaces. By drawing on the humanity and seeing each other as equal contributors, both in our digital and physical spaces, creates a fertile ground to allow kindness to flourish and foster connections within our community. I think this is fundamentally what kindness means within the context of Ethos. And I'll pass it over to Antonia, who will kind of share a bit more about the bigger picture.
Yes, and thank you so much, Joanne, for such a great summary of how kindness has manifested in everything that we've done over the course of the pandemic. And not only just also expressing the fact that Ethos Lab was a response to not only the emergency that is the underrepresentation of Black youth in tech, but also the urgency and need for there to be these spaces of innovation for young people to be able to flourish in. Ethos Lab is only, as drawing on Joanne's analogy, a seed where we're able to plant these ideas and plant and root young people where they're able to think collaboratively, operate again collaboratively in community, leveraging and empowering them through the tools and skills, and also having them operate in integrity. The creation of space and having Black leadership in creating these different spaces, it allows us to start addressing and looking at larger intersecting issues that ended up coming out throughout the COVID pandemic. Not only were we trying to create these spaces of innovation where young people could come together, but the pandemic highlighted not just the digital divide that impacted youth active and meaningful participation in some of the work that we were doing, but we as a larger society need to ask ourselves, how does this digital divide and how do these spaces of inequality, systematic racism, operate as also, as I say here, kind of the poverty of kindness that was there already. So what does it even mean to create these new systems and these new ways of being when we know that there are these overlapping systems that have been unkind to many communities? And we only hope that Ethos Lab can be that space where we're able to continue to inspire and foster that kindness that we all want to see in the world. We have 1 minute left and I had a bit more to say, but I did want to just talk about how it is youth at the center of what we're doing at Ethos Lab. And youth stepped into this space amidst the pandemic when thinking about what a digital community could look like for them. Atlanthos was inspired by a poem that was written by the young people, and I wish to read it right now, and I'll throw to our video of what Atlanthos is, where young people come to collaborate, celebrate, and innovate. Atlanthos, a tangible virtual underwater arena across pinkish fields under a big aqua blue sky with seaweed snacks and plenty of sushi. And when they expressed what they missed their schools, they missed their auditoriums, their basketball courts and their libraries, their soccer fields and undercover areas, and many undiscovered places that were waiting to be discovered. In Atlanthos, and when we talk about kindness, this is how they describe it. We are joined with friends new and old to play, to sing, to eat, to learn, and to gain the superpower of joy and growth. Kindness isn't just a relational act in the moment, but kindness is the soil that fosters our growth of connectedness. And I'd like to throw to our video of the space of Atlanthos that was created, developed by youth and for youth to move us into a kinder future.
Thank you very much. Thank you, Joanne. Thank you, Antonia, for that picture, that insight into the great work you've been doing with Ethos Lab. That's inspiring. We're going to move to our final speaker for opening remarks, and then we'll get to our discussion. And so Jennifer Johnstone is the executive director of the Central City Foundation, founded in 1907 in Vancouver's inner city. And I can imagine, Jennifer, that as the director of a neighborhood-based philanthropic organization at the time of COVID, that it must be a little bit heartbreaking to hear about some of these great initiatives and opportunities that, as inspiring as they are, still don't even begin to touch on the devastation that's being felt by some of the most marginalized in our cities. And I wonder if you can talk to us a little bit about the work that you've been doing at Central City Foundation.
Thanks so much, Meg. Good evening, everyone. I'm really delighted to join you this evening. I'm joining you from my home here in Richmond, which British Columbia, which is on the unceded, ancestral, and occupied territory of the Musqueam peoples. As a 7th generation settler Canadian, I remain an uninvited guest upon these lands, and I offer my deep gratitude to the generations of labor and resistance that have kept these lands and protected these waters since time immemorial. For me, kindness is all about finding ways to help and lift up others. It's not always nice, and it is often more concerned with doing what is right and kind than about being popular or liked. In my recent experience, I'm also going to argue that in the face of this COVID-19 pandemic in the inner city, Kindness is an act of solidarity and profound resistance. Founded by a handful of concerned Vancouver neighbors in 1907, Central City Foundation has been practicing kindness in our city for more than a century. For more than 80 years at the Central City Mission on Abbott Street, we serve the people of Vancouver's inner city with supports and resources and unflinching kindness to ensure that everyone in our community had the help they needed and the opportunity to improve their lives. We've continued this work in recent decades through the Central City Foundation, where we mobilize people and resources to support community-led solutions, leading us closer to a truly inclusive community where everyone has the opportunity to share their gifts, to prosper, participate, and reach their full potential. We're a unique foundation in Canada, where today we're about a $50 million foundation with more than half of our capital invested in our mission through social purpose real estate that provides secure, subsidized, safe space for community organizations who are serving folks in our inner city and beyond. Here in our inner city, in Vancouver's downtown east side, these past few months, we've witnessed some of the most devastating consequences of the COVID-19 pandemic and our necessary public health response to that pandemic. When the rest of us were sent home to stay safe, hundreds of people were first forced out onto our city streets. Provided with only a handful of portable hand washing stations, some porta potties, and to-go meals with nowhere to go, the consequences were devastating, indeed deadly, in our inner city. The forced closure of community agencies, food programs, and safe spaces in the inner city made the lives of people in our community so much harder during this pandemic. Those who've been marginalized by decades of policies that have deepened poverty and are steeped in colonialism and systemic racism. Those who've struggled for generations with the resulting trauma, all while facing the deadly consequences of the ongoing health emergency of the opioid crisis and the continued epidemic of endemic gender-based violence across our community. They face the daunting challenges of everyday survival without access to critical services and supports. However, so there is some good news. We also witnessed a truly unprecedented mobilization of kindness in our inner city. Collaborative efforts led by community organizations in the downtown east side and indeed across Metro Vancouver to provide critical support from food, shelter, and basic health supplies to information and connection were mobilized urgently and immediately in the community to keep individuals and families somewhat safer in this pandemic. And I want to share with you some of the extraordinary examples of this kindness in action. So social enterprises in community redeployed workers amongst many different organizations to ensure continued employment. Hundreds of peer workers were enlisted to deliver meals and basic public health information across the inner city. Basic income support for those left without employment, but who simply didn't qualify for any government supports sprang up. From solidarity funds for sex workers to income supports mobilized from organizational reserves or community donations for binners and many others. When the network of already inadequate food security in our city was shut down, the Potluck Cafe and Catering Society, a well-known social enterprise in our community, led the collaboration of an amazing network of nonprofits, local businesses, and others to deliver more than 140,000 meals to residents in the inner city, inside private single-room occupancy hotels and outside on city streets for those without shelter. And when the very few safe spaces for women and gender diverse residents of the inner city were forced to close or severely reduce access, giant tents were organized to provide warmth, shelter, food, basic hygiene, safe bathrooms, overdose prevention supports, respite, and safety where there was none. Atira's Sister Square, the Wish Drop-In Center, and the Downtown Eastside Women's Center shelter mobilized to address the deadly increase in violence against women that was a consequence of this pandemic across our globe and throughout our inner city. Throughout these past 8 months, community groups on the ground, together with those with lived experience, have organized a response that is rooted in kindness and care, but also in resistance to the systems that continue to oppress and marginalize folks. They have advocated at every turn for a community-led solution to this crisis. for a made in the community of the downtown East Side solution to provide safety and support for residents in this neighborhood. And they are continuing this struggle today. Finally, there are many more stories of kindness and care in the face of this deadly pandemic in our inner city community. And none of these acts of kindness would have been possible without the rapid response of our philanthropic community. Tens of millions of dollars were deployed rapidly and amazingly without any strings attached to support these efforts. I have never been more inspired by the power of philanthropy to mobilize resources, foster connections, and provide opportunities to invest in our shared love of humanity than I have during these extraordinary times. The urgency for us all to come together and support our neighbors in the face of the COVID-19 pandemic with its dire health and economic impacts across our world was crystal clear, and we answered that call in the inner city of Vancouver with kindness indeed. As we look to recovery from this pandemic at Central City Foundation, we will continue to invest in and amplify the community-led solutions that move us closer to a transformed future that is more just, more inclusive, decolonized, equitable, peaceful, sustainable, and kind. Thank you so much.
Thanks very much, Jennifer. So we've done the tour of the panel, and I want to encourage our participants and our attendees to think about the question that you'd like to pose or the comment that you'd like to pose to this panel with a whole lot of good thinking and action on what it is taking and what it would take to institute kindness in a serious way as in our cities today. I'm going to kick off with a question to the panel as a whole. So I'm going to ask if everybody could show their faces, please. Thank you. And I suppose it has not gone unnoticed by everyone that this is an entirely feminine panel. And so I wanted to kick off with a question that was posed by an anonymously in the Q&A box about the difference that we see in our different ways of approaching this question between kindness and niceness. So if there is an idea or an example from your work about how to, I mean, you've already touched upon this in some ways, but perhaps an additional example that could really cement the distinction that we should be making between the often feminized and perhaps unserious concept of niceness that we maybe do a little bit too often as women in Canadian society, and what you're talking about when you're talking about kindness. Helen, do you want to kick us off?
Well, I was thinking when I did a bit of Googling about kindness prior to this event that a lot of the results coming up were about the politics of kindness and how the liberal political movements in different countries around the world have adopted kindness as something that's associated with liberal policies because of increased support for social welfare systems, and particularly Jacinda Ardern. And I think that is very interesting given New Zealand's position in the COVID pandemic. She was very clear with her messaging about kindness and community and support for everybody. And she has been throughout a number of crises that occurred in New Zealand. I think she's a fantastic woman leader, demonstrating what female leadership looks like. It's not necessarily about being nice, it's about doing the right thing to support people and being empathetic. But I also would point out that I think empathy and understanding other people's needs, for me personally, increased a lot in the process of having children. And I do think that there could be some interesting, gender and social and biological reasons why women may be very aware of other people's needs. And that is, something open for discussion. I'm not an expert in that area. So yeah, I would probably pass it back to other panelists to add more.
Thanks, Helen. Who wants to take a stab at that next?
I'll jump in.
Please.
It's Kate. So I sit on a lot of government tables about COVID-19 and have really deeply encountered this Canadian politeness in bureaucracy in particular as a barrier to getting good things done. And I do think that that is something that we need to face head on, that there's a veneer of sort of, professionalism that is expected, that's rooted in whiteness, it's rooted in maleness, it's rooted in certain old-fashioned structures of power. And it can feel really impolite to disrupt those tables with urgent messages about equity. So I agree. I think that kindness requires some real courage in speaking truth to those powers and in ensuring more diversity around these tables and more expertise around these tables to change those norms. And so one thing that we did at the Alliance early on, for example, was ensure Black and Indigenous leadership on bioethics tables, because otherwise it just wasn't present at all. So changing the culture of those tables is a key part of it. But I do also want to acknowledge that individual level niceness and kindness in our work on social prescribing was really transformative for people. And that can be lost in people's faceless encounters with government systems, including healthcare. And so there is a bit of that individual level core humanity that we need to restore and renew in our system. So I don't think it's an either or, but it's a both and situation where we put our courage and our principles in action in a loving way.
Yeah, and you raise an interesting distinction, and you did in your presentation too, about what is required of us as individuals and what is required of us as members of institutions or as builders of new institutions and members of communities. And maybe there's some kind of a leap there that has to be made between what we can feel and how we can act as individuals, and that important sort of feedback process that you were talking about too. Which is something to consider more. We're starting to get some suggestions here. So we've got Sarah Pott. Sarah, would you like to unmute and share your thought about niceness versus kindness, if possible?
Hi, can you hear me?
Yes.
Yeah, I wondered if there's even just a question of depth with the word niceness versus the word kindness. And that, as I wrote in the chat box, that niceness is possible without a relationship, but that's where it stays. Whereas authentic kindness is relational. And in my own experience as a mom and in the different roles I carry as a professional, I've often thought of it in this way, that we might have different positions and even different philosophies or perspectives, but when we are authentic in offering kindness, our posture towards each other offers dignity and respect, and it allows us to still amplify each other's voices, to empower each other, even if we don't actually agree with each other on some fundamental pieces, we still are able to do good things together. And I think that is part of the distinction between niceness and kindness.
Thank you, Sarah. Anthonia and Joanne, I could hear you trying to maybe suggest a counter understanding or a new understanding of what kindness is in your work. Do you have any reflections on the difference between kindness and niceness?
I'll just jump in there if that's okay, Joanne. I'm sure you probably have a ton of thoughts, but I really do want to jump on the last point that Joanne had put forward around integrity, and that idea of kindness almost actually being an act of resistance. And I know sometimes If you take it, we talk about it relationally. So even if we talk about it at the individual level and we talk about self-care and I need to be kind to myself, it's really pushing back against, you know, the capitalist system that tells us that we need to really work really hard, to also, you know, these sitting at the table with a lot of nice, well-intentioned individuals that want to talk about changing these different systems, and being kind is actually responding to and remaining in integrity and standing up against those systems. So I definitely see and agree with all the other people who have responded on kindness maybe being more of an action that does require deep empathy, relationship, whereas I don't think anyone's liked anything that's just like nice people, it's nice, nice policy, you know, that it's never really ever been effective, but one that has kind, it feels like it's rooted in a humanity that we're trying to move forward with.
Yeah, that was a beautiful way of putting it, Antonia. Jennifer, I was just wanting to respond to what you said, which was this notion of kindness as solidarity and resistance, which I really, really like. And I think for me, you know, be kind, be calm, be safe. That's great as a request for how we should approach each other, right? But I don't think we should be calm about injustice. And so I think we need to be kind with people and tough with like systems that need to shift.
Jennifer, do you want to weigh in on this one?
Yeah, no, I mean, I would build on what on what Michelle said and what I sort of said in my remarks. Really, you know, kindness, certainly in the face of the kind of deprivation and oppression and just daily grind to survive in the inner city, requires organizing, and it is an act of resistance, and it is an act of solidarity with each other. And we saw that, you know, the community was abandoned, and the community didn't you know, decided to be kind to each other, to organize, right, and to keep people alive, despite being abandoned at the beginning of the COVID lockdown. So, you know, I saw amazing, I've seen all along and continue to see this amazing organizing where kindness and love are powerful forces. These are not unserious. These are not, you know, not powerful forces in our world. I had the opportunity to bear witness to the Progressive International Summit earlier this summer. I don't know if anyone else was listening as I was listening, it was called Internationalism or Extinction. And really was about how we have to come together across the globe in our progressive movements to build this new world that we want. And one of the speakers was Vijay Prashad, who is an author, recently wrote something called Washington Bullets. He said something that I thought was so powerful. And he said, our hearts are bigger than their guns, and our love will overcome their greed and indifference. And that these are powerful forces in our world. We see this every day in the inner city, and throughout our community and throughout the philanthropic community. So, you know, for me, niceness is about feeling good about yourself. Kindness is about lifting up others.
Thank you. Lindsay Lafrenière, you had a point about the opposite of kindness. I was wondering if you wanted to ask your question. If you wanted to unmute yourself.
Not sure if she's there, Meg. We've allowed her permission to unmute, but she's not doing it. So.
But she's not doing it. Okay, so basically, here's a question. Appreciating the presentations and asking about what there is an observable increase in hatred in Canada this year. QAnon, anti-maskers, men's rights activists, etc. Do you think this right-wing extremism is actually on the rise in Canada, or just amplified at this time? At the start of the pandemic, I was so inspired by the kindness shown, but now I've seen so much hatred on the streets and online. Why do you think the pandemic is bringing this on as well?
If I could start, in my opinion, I believe that there has been a hyper visibility of things that have already been under the surface prior to the pandemic. I think with people being at home and being isolated, they've leaned a lot more into communities that they feel supported in, and that often includes communities where the right wing can continue to grow perspectives and things outside of what is considered socially acceptable and socially kind. I think that there's a lot of things that have been brought to the forefront that have been in existence, and I think the world is shaking up in a lot of different ways. And I think that the things that we associate with negative traits in society are now sort of highlighted because they're kind of coming back out of the dark in a way that demonstrates a more comfortability in both being kind and being unkind within public spaces as well.
Thanks, Joan. Yes, Jennifer.
I'll think of someone else if they want to. I mean, yes, there's been an amplification of what that question was about hate and but there's also been this incredible flourishing of resistance. Right? We have seen, the anti-racism demonstrations across the globe in support of Black Lives Matter were the largest demonstrations in history. So yes, we may be seeing a rise in that amplification, but we're also seeing people in this pandemic, while at the same time the divisions between us and the inequities may be amplified. People are also joining together in movements across our world to try to make that change and to envision that new future. And whether it's the folks involved with a green recovery or the feminist recovery, or all of those folks are coming together to resist and to foster connections and relationships in order to build towards that different future, and to challenge the way, the extractive way we've organized our world in service to capital and inequity for too many generations.
I would like to add something
Please.
there. I think that with the increase in some hate speech and right-wing movements in relation to coming out of COVID, I think it's been driven by fear and a desire to pin the blame on somebody else. And because COVID is a syndemic and it's linked to all these social and economic and environmental drivers, it's a complex problem and there is no simple solution. And I think that is really hard for people to deal with and process. It's very similar to the climate crisis and other environmental degradation. And I think it reminds me a little bit also of when you talk about putting in new homes or mixed tenure communities in a place and you get a lot of NIMBYism, people don't want that in their area. It's not willing to share the resources, but thinking that somebody else has the responsibility to sort those problems out and not within our own area. So I don't need to change my behavior. I will just put the problems onto another group and say they can sort that out for themselves, and also pinning some fault on them. So rather than accepting, as Jennifer said, that these causes could be related to structural barriers or macroeconomic decisions, putting it more onto the individual choice. And so I think from my perspective, this point on kindness comes to this greater understanding within our professional work, whatever that might be for people on this webinar, that we have to think beyond our own perspectives and our own knowledge of people's circumstances to a much broader understanding. apologies if I'm not 100% coherent. It's now coming up on 3 a.m.
You got a comment. Well said.
Oh, good.
No, I think that's clear. And it makes me think of the point that Joanne and Antonia were making too, about the need to create spaces as a first step in which people can see other people as belonging. And reflects on Jennifer's point too, I think, about the sense of abandonment, although and just our ability to confront extreme difference and what looks to be extreme devastation.
Meg, can I jump in on that as well?
Please.
This is something that we've encountered even within our own network of community health centers across Ontario, where rural centers, for example, for some reason seem to be feeling threatened by advances in our work on anti-oppression and Black health, for example, or resistance to police violence. I think it is, right-wing organizers are adept at creating a sense of belonging in small groups and maybe in counter to other groups, but they're creating a community. And I think that's part of what we need to consider when we are disrupting this, is that all of the research about health inequity shows that inequitable societies are less healthy for everyone. It's not a zero-sum game. Gains in health and well-being and self-determination for some people don't come at the expense of privileges that other people have. That's just not how it works. And so we have work to do in educating ourselves and one another about the benefits. And I think COVID is a good example of that, where none of us is safe until every one of us is safe. And so when we have approaches like California, where they have a health equity metric, where a county can't reopen economically until it has invested in the most marginalized communities and those with the highest rates of COVID. Because it just doesn't make sense. The virus will not be eradicated if you can't eradicate it in places where structural vulnerabilities are highest. So I think we have work to do on educating ourselves and one another about how this is in our collective interest, and in creating that sense of belonging that that counters that feeling of being threatened or having loss. That right-wing organizers have capitalized on. We can also capitalize on that in a way that's healthy and inclusive, and we have a lot of work to do to really think that through.
Thanks very much, Kate. It's an answer that that addresses a question that's asked by Raheel in the Q&A window. So I wanted to ask Raheel if you wanted to unmute yourself and ask your question.
Yeah, sure. First, can you hear me?
Yes, loud and clear.
First, thank you so much for the great presentations and the incredible discussion afterward. It's very informative. We know that already it has been mentioned that we know that this problem of social isolation and loneliness is a serious problem in our community. And it's easy to imagine how the pandemic can make it worse. And the economic crisis and the austerity era that comes after that, it can definitely deepen this situation. And those people who have been more socially isolated and have serious problems in that regard, they gonna disproportionately impacted by this crisis. And it's easy, we can imagine if people cannot, they can't have jobs, they cannot pay their rents, and they can't have their basic needs is not responded. They gonna have those thinking about those social connectedness, thinking about being in a more collaborative situation with their community. It is it's going to be very harder for them. And I think the projects and the that are targeted for those community in this situation. It is they are very harder to in this situation to actually get support from the government. How can we, as the researchers, as people who are interested, who care about these situations, social justice, can encourage the governments, can demand government and other organizations who can provide support for these kinds of these kinds of support for these people. How can we actually demand this in a more rigorous way, so we can have a better support for this
Okay, thank you very much, Raheel. So a question about better government supports, better policy demands. What's the agenda? Kate, you want to organize us?
Yeah, I mean, so that's my jam, government relations. One of the reasons we structured our social prescribing work the way we did and didn't just focus on some of the informal approaches that we know are really great, is to build the evidence base to advocate for policy change. People they always want to have like made in Ontario or made in BC, local solutions that demonstrate that this is feasible, that it works, and ideally saves money. And so our research shows, that it does, that all those things are helpful, and we're able to take that back to government and start making the case for this kind of investment, so that a small upfront investment creates huge savings across the system. New Zealand has done a great job of this on their using well-being budgets, for example, because what the challenge is that the benefits accrue to different ministries or different arms of government or different scales of government. And so it's very difficult for them to see some of this work as being in their interest. And so I think that's where the broader measurement of well-being beyond GDP and having well-being budgeting and understanding the benefits of prevention and all that stuff are going to be critical in making the case for that, both in the short term in terms of immediate COVID aid and in the longer term.
Thanks very much, Kate. And that gets at the next question in the chat, which is really, I think, more about the implications of resource shortages for this kind of work too. So Bikram, would you like to ask your question? Or I can ask it for you, no big deal. Okay, well, so Bikram's asking a question to the whole panel. How do you think kindness plays out in resource poor settings? For example, in the context where health infrastructure is not adequate and where citizens fight for limited resources. Do limited resources affect the way in which kindness is played out and practiced?
I'm going to jump in there, and I'll speak about it at two levels. I think when we talk about just the limited resources that were happening before the pandemic as well, that it creates an environment of scarcity and competition, oftentimes between different nonprofit or organizations within that sector. So I think that resource shortages in that way. When you really need to just be able to deliver particular services, it sometimes can create that kind of tension between different organizations. But I think what we saw in terms of influx of resources coming in and what happened with COVID, there was that need for everyone to come together and collaborate. So I think it was a little bit of both. There was that acute issue of kindness and resource scarcity, but then in COVID, people kind of coming together, the need to share resources and also share different ideas. From just taking it from our experience in engaging with young people, like the kindness factor of just everyone kind of being in it together. And I think with how we've instituted like gratitude checkouts in all of the work that we do has really allowed for kindness to just, in spite of it all, we are all in this together. And I think that when you start to create those different environments where there is that shared, again, empathy, we've all gone through this kind of shared experience, not just COVID, but in addressing these kind of the major issues around George Floyd and seeing and now police in schools as a traumatic issue that all of them are dealing with, is kind of, you know, we're all in this together. We need to be and we need to be together. So I think kindness has really shown that if there aren't a lot of resources, we can tell that the young people were very inspired and moved with intention in wanting to create those spaces anyways, despite what they had in front of them. So, yeah.
Thanks very much, Antonia. Those are some good practical ideas, like gratitude checkout. Just any other thoughts on how to deal with resource scarcity, with competition in between residents who all have needs?
Just one quick note that non-Western health systems with robust community health sector have had excellent responses to COVID. They have experience dealing with infectious disease, they have experience leveraging scarce resources, and they have experience building the trust of community. And so I think we actually have a lot to learn from resource poor settings in dealing with this in a way that's complex, adaptive, and effective in operationalizing at the very, very local level. So actually those settings can be really, really driving change for us.
Thanks.
And I might just add that, you know, despite my painting a picture, a challenging picture of life under COVID, the pandemic and the virus itself was tremendously controlled because of the community response in the downtown east side and because of the kindness that neighbors showed each other in taking care of each other. So in that scarce resource community, kindness actually was enacted daily and in tremendous ways that kept people safe.
Thanks. Carolyn Canfield, in the chat, you've have some questions about relative deprivation and rural communities in particular. Do you want to unmute yourself and ask your question?
Well, I've been thinking about the ways in which rural communities are aware of social needs to an extent that urban communities may be blind to. So when the pandemic arrives as another destabilizing force, it really brings into sharp focus the connections that people in rural areas have to each other already. And you know, I think that urban communities can learn a lot from rural connectiveness, connective sensitivity. You know, we develop in rural areas. I mean, many people who live in rural areas are very self-sustaining. They take great pride in being individualistic and successful in isolation, and yet they're aware vividly of the dependencies. So some of that is not so obvious in urban areas, and I wonder if the adaptive capacity of rural communities can teach something to urban environments about the necessity of making encounters individual, making encounters human scale. Well, you know, I fully grant that in urban environments, we need institutional infrastructure. There are many needs that are invisible. There are many individuals who are invisible. But I also think creating encounters that are deeply personal, deeply individual, are the ways of building the infrastructure that that is durable. You know, I really have enjoyed the examples that we've heard tonight of ways of reaching out and that generosity, that extension of welcome. of attachment, of connectivity. And I think that you know, the way I see it, having lived most of my adult life in rural environments, I see that as a way of extending rural habits into the city, of finding that individual encounter.
Yeah, all right. Thank you very much, Carolyn. I wonder if Helen Pinio might have some thoughts about what you've noticed in rural England, particularly in your efforts to come up with a different framing and understanding of development that is sustainable for all.
Well, I think, you know, rural environments are different. That, you know, it depends on what you mean by rural. So if you're talking about a village in England, you can have quite a good sense of social connection if you live near to the village, and you can walk or get near to your neighbors easily. But you can also have more dispersed areas. And I grew up in a semi-rural environment where you know, it wasn't easy to necessarily walk to another child's house to play and things like that. So I think with urban environments, we certainly can have a great sense of community and social connection, and that can be reinforced and supported through the design of urban spaces, creating space for interaction in front of our homes in semi-private spaces. And I really enjoy that in the community that I live in, London, where we have terraced houses and small front gardens, slightly bigger back gardens. And so you just have a lot of opportunity on a day-to-day basis for interaction with your neighbors over anything where you might be coming in and out of the house. And I feel there's a very tight-knit community here. And I think that can be created in a city of 10 million people, just as it can in a small village of, you know, 300 or 1,000. I think with the idea of 15-minute neighborhoods that's really popular right now in Europe, the mayor of Paris is really supporting this 15-minute neighborhood idea that you can live your day-to-day life needs, get to work and school and whatever within a 15-minute commute. Just builds on that sense that people want to have a local community and where they can sort of base themselves. And particularly during the lockdown, I think people have looked into their local community to support their needs day to day. And although I don't think that's possible in all large cities all the time, sometimes we will need to commute to certain parts of the city for work or, you know, leisure activities, et cetera. I do think that in having that mixed use of land and putting housing and other uses nearby, so we can have a bit more of a mixture, can help us to create that sense of community even in big cities.
Thanks very much, Helen. We're drawing up to a close of our time together, so I just wanted to open up for last thoughts from our panelists on this topic of kindness and post-COVID response. We've heard a lot tonight already of new frameworks for thinking about kindness, new frameworks for taking action towards protection, safety, sociability, and radical kindness for different groups in different parts of our society facing different challenges. What are maybe one last parting thought that any of our panelists would like to offer tonight before we close? Antonia, I thought I saw you maybe on the verge of saying something.
I was going to say something with regards to the rural and urban, but I think just to kind of wrap it up with your comment, I want to come back to your first question around the difference between nice and kind. And I feel like nice is what has got us all these social issues. And I think we really need to actually keep on pushing past the niceness. Being nice is showing up for the protest and walking, and being kind is standing with me as I'm fighting for police to get out of school so my daughter feels safe, right? So and understanding how those again, seeing that as mothers, as people with children, and we're all in the same school, that we're all in it together. There is some deep unkindness happening and some deep niceness on these very on the ground issues that go past donating to Ethos Lab. That's nice. What's kind is addressing these major issues that happen when you see each other as human, and that's, we need to get past nice. We need to be kind.
Thank you very much, Antonia. Other final thoughts that others want to add?
I think just to build on that, Antonia, is that I think to be truly kind, you need to be vulnerable, and you need to see that other people's vulnerability is dangerous to you as well, right? And I think COVID is teaching us that to some degree, but I think true kindness requires us to get uncomfortable and to really push hard, just in the very way you're saying, Antonia, to go beyond niceness into the uncomfortable terrain of kind of deeper solidarity and resistance, and questioning our own comfort, right? Yeah.
Thank you. Joanne?
Yeah, I think I was just going to build off of what both Antonia and Michelle said, and just really ground my kind of final thoughts in the idea that kindness is an extension of the self. And in hearing all of the interconnectivity in what we're talking about and the work that we're all doing that's very different, but also has so many similar themes, it's just something that I look forward to hearing other people create more connections for, and extending kindness further, and kind of pushing the boundaries of what kindness is, and continuing to shift away from the notion of niceness, or the kind of static idea of what it is to be nice.
Thanks. Jennifer?
Yeah, I wanted to issue an invitation as opposed to some final thoughts. In addition to, we'll all be here for the rest of the SFU Pandemonium series. We're part of Feminists Deliver, a collaborative here in Vancouver, and we're excited because we're hosting a panel on November 6th. It's in the chat with Dr. Angela Davis, Dr. Pam Palmater, Erica Phil, Harsha Walia, and hosted by our own Angela Marie McDougall. We're going to talk about toward liberation and evolving beyond that 21st century capitalism. So super excited about that and how that will inform our organizing here and other places. So just want to make sure that everyone was invited.
Excellent. Thank you so much. Helen?
I'll just say that I think we should extend our kindness to the planet, to the ecosystems that support us, and that will be mutually reinforcing for our health and well-being and our social interactions with each other, because things will only get worse if we ignore those challenges there in front of us. That would be my closing point. Thank you for having me very much in this call.
Thank you very much for participating all the way from the other side of the time zone scale. Kate.
I just want to encourage everyone to keep following the amazing women that have been on this call today and amplify their work and their voices. Thanks.
Yeah, and thanks for my part as well, again, for all of your amazing work that you've brought here tonight, and that you are continuing to push forward to challenge the fundamentals of what we think we're up to when we go out into the world and we attempt to do right and to do good. That brings our event tonight to a close. Please do look out for a recording of our session and presentations made available to learn more, to reflect more, and please do join us again for the next installment in our Pandemonium webinar series, in which we'll focus on the post-COVID-19 urban economy, following up from Jennifer's event too, but at the end of November, November 25th. Thanks very much to our friends at Public Square. Thanks very much to all of the participants for all of your great questions and your support and your commentary in the chat. Have a good evening, everyone, and stay kind.